So I just got into the airport a little bit ago. I'm from Richmond, Virginia, so I flew from Richmond to Miami and then Miami to Panama. It's a pretty easy, quick trip, but I'm excited to get to be back. Got to meet up with Gabby. Normally, Gabby and I work together virtually, so it's always really fun when we can link up and get to do stuff like this together in person. So we've made it out of the city. We've been driving for a couple of hours east, so we're, almost getting to the edge of Panama, and we're about to enter into the Darién province. So this is actually where Global Brigades started. So what's cool about this area is we have communities that have several different projects in them, and when a community has all the different projects, we refer to them as an empowered or a holistic community. So in some of the communities that we're visiting, we're going to go to Las Piñitas. We're also going to go to Javisa. We'll be able to see both water projects and medical projects. And then some of these communities also even have community banks and other business projects going on. So we'll be able to see a little bit of everything, all where Global Brigade started in Panama. We are out in Darién and we're getting ready to head out to check out a water project a little bit outside of where we stayed. I've been to a medical brigade before, so I've seen our clinic projects in action, but I actually haven't seen a water project in action, which I'm really excited about. So first we're going to stop by the office and then we'll be heading out into the community. So let's go. So this project specifically is called El Proyecto Baido, and Baido is in Embera, one of the indigenous languages here, and means water. So Global Brigade started just with health projects. Originally, we were doing clinics, we were training community health workers, and we're solely focused on health specifically. But over time, it became really clear that clinics were, of course, really beneficial in the communities, but only we're going to do so much if there still were a lot of issues with water quality and the health issues that come with poor water quality. So I'm really excited today to get to see a little bit more and kind of see some of the projects on the ground and see how things are looking.
Honestly, this river is very, very important for everyone in Darién. You can see people using boats to go to their houses in here, or they're bathing on the river, or they are drinking water from the river, or they're cooking with water from the river. So at the end of the day, this river is pretty much their lives. Like everything for them or everything that happens in their lives somehow leads to this river over here.
We're about to take our last step of the journey to the community we're going to visit. So we're about to take a boat about 30 minutes out to go to Las Pavitos, and we'll check it out once we're there. So we're on the boat, we're heading out. This is the first place I've ever been to that you really could only get to by boat, which is really cool. It's really exciting to get to see a place that is so far out from the city and is unlike really anywhere else that I've been to. The only way that you can get there is by boat. So as we were loading up, we saw a lot of other boats that were loading up with like rice and water and like other essentials that are being taken out to the community there. So we'll be on the boat for about 20 more minutes. That's about a 30-minute boat ride, and then we'll show you around a little bit more once we get there. We've made it out to Los Pavitos, and obviously we came here via boat. We were on the water for about 30 minutes getting out to this community, but despite, being able to get here by water, water is a really big challenge in this community, and it's something that we want to talk a little bit more about with the community's members here. So the challenge is both getting water up from the river to these homes, and then also the quality of the water, making sure that it is, clean and potable and not causing illnesses.
Antes del proyecto de agua, nosotros pedíamos del río y siempre el agua está contaminada. Para el invierno, más aprovechamos cuando venía la lluvia, recogíamos nuestro tanque de agua y le echábamos cloro y cosas así.
La vida antes de que no tenían agua potable, la mayoría siempre sufrían con bacterias como ameba, diarrea, a veces mucho nos daba dolor de estómago.
Hay comunidades que no tienen absolutamente nada, entonces no tenían nada, llegamos nosotros acá con Global y UNICEF y le estamos dando ese apoyo. Como aquí en Nuevo Vigía, venimos a construir los 2 tanques de 30.000 metros cúbicos para tema de agua, para abastecer a la comunidad.
Fuimos desarrollando un estudio para ver cómo era la comunidad, cuántas personas tiene la comunidad y muchas otras cosas. Pero la clave del éxito de esto, y principalmente, es el acompañamiento. No lo hemos dejado solo. Adicional a esto, hay un elemento muy importante, que es la recaudación de fondos para mantener esos acueductos. Eso se llaman juntas administradoras de acueductos rurales, que le llaman JAR. Y estas JAR, nosotros le damos todo el seguimiento.
Yo como vicepresidente, la JAR, nosotros somos los indicados que tenemos que tener el mantenimiento del acueducto para darle una mejor calidad de agua a los moradores de aquí de nuestro pueblo, pues. Y darle a la comunidad una mejora, de que ya no tienen que ir al río, pues hoy en día el río está demasiado contaminado. Entonces, con eso nosotros tenemos la responsabilidad de que la comunidad, los niños y los mayores y los adultos estén bien de salud, con una buena agua. Ese es el compromiso que nosotros tenemos como JAR a la comunidad y a todos los que ven aquí a visitar.
Cuando empecé a trabajar aquí, tuvimos un acuerdo con la comunidad y acá el programa, ¿no? Un 50% que nos da la comunidad y el 50% lo damos nosotros. O sea, en mano de obra no calificada dentro de la comunidad, los técnicos lo damos nosotros, entonces ellos nos dan como el apoyo.
Pues necesitamos eso porque a veces no estamos capacitados en este invento y tenemos que capacitarnos también todo. Y cualquier cosa, si nos necesita, nosotros estamos aquí también siempre al lado de ustedes y ustedes al lado de nosotros, que sigamos juntamente para adelante.
El proyecto del gobierno solamente llegó en tuberías madre. Entonces, gracias a Global Brigade fue que nos apoyó en eso y nos sigue ayudando en eso de llegar a las casas, porque nos donó tubería de llegar agua a las casas.
Aquí en Nuevo Vigía solo falta las conexiones desde el tanque madre hacia la comunidad. Solo falta algunos detallitos que realmente ellos quieren conectarse de la línea madre hacia la casa de ellos. Eso es el único paso que falta aquí en Nuevo Vigía.
por este momento nosotros acá en el pueblo, la comunidad, a la semana antepasada estamos reunidos, hablamos la tubería, porque la tubería es pequeña para nuestra casa. Yo quiero tenerlo en mi casa propia y tomar esa agua, pues, bien clorificada y bañarse quizás ahí mismo o tener en nuestro servicio para tenerlo más bien cómodo en nuestra casa, en nuestro hogar, pues.
Bueno, sí, nosotros estamos luchando por eso, pues, como ya yo estoy bajando ya la edad, entonces nosotros estamos luchando para los niñeces que venga creciendo va a administrar esta agua más tarde en el futuro, no somos nosotros ya.
Bueno, me siento principalmente complacido como ser humano y como persona, porque este es un proyecto noble. Mejorar estas condiciones de vida para ellos es algo que en realidad es indescriptible. Y los estudiantes siempre que me ven están contentos porque saben que estamos haciendo algo que redunda en beneficio a esa comunidad y que sí va a llegar, que sí les va a llegar, que sí va a ser lo que ellos esperaban.
So we're here with a couple different universities. University of Birmingham from England, as well as Texas A&M, are both here this week checking out and helping support this rural clinic. We're out in Piedras Gordas. So our medical brigades are a week long, and they work with volunteers that are often university students or medical school students that come down to one of our partner countries to work alongside local healthcare professionals over the course of a week. So we're going to be able to see what's going on in the clinic here. Our clinics we refer to as mobile clinics because we typically set up in a school or in a community center in an area that does not have another clinic or hospital typically very close. So within the clinic, we have different stations going on. We have general consultation, pharmacy, public health, dental, and vision. So we're going to be able to see a little bit of all of that. But something really important to note is that on all of our brigades and in all of our stations, the students are working alongside local healthcare professionals. So in terms of language, cultural competency, and also sustainability of the programs, everything that the students are doing is alongside local healthcare providers.
Hi, I'm Nicole. We're currently in Panama on a Global Brigade. I'm with Texas A&M University. So today I'm going to take you along on the compound tour with everyone here. All right, so right now we are about to go into the triage station. This is intake where patients first come in, if you'll come along with us. So here first we take height, temperature, and our weight. And then we can see all of the kids practicing their blood pressure skills. It did take a while for me to learn how to take blood pressure. It's definitely a thing you have to be very detailed about, kind of hear it out. We also take pulse oximeter, which is the O2 levels, and then we take your pulse. We write it all down on a sheet, and we're monitored by some helpers, translators, to help talk with the community.
Perfect. Do you speak Spanish?
I do, we speak Spanish.
Perfect.
It definitely helps out just because, talking to the patients, communicating with them and all that, it helps.
Yeah, definitely. So I know it's been a little quieter today. How was it? I know this is day 2,
This
right?
is day 2 in this community. We're in Piedras Gordas. Yesterday it was jam-packed, but today I feel like we'll move on to the consult in a little and you'll see everyone there.
Okay.
So it's definitely a lot more people yesterday than it was today.
Awesome. Great.
Okay, so right now we are right in front of the consult room. This is where patients wait and get seen by one of our 2 doctors here. And after that, they head over to, we have also a dental center. So it's either they come in for dental, come in for medical, depending on what they need. So right now we're right in front of the dental station. It's one of the stations that we've been rotating through. I have yet to get the opportunity to come through here, but I think tomorrow will be my chance. Right now we have a really amazing dentist. We're doing extractions, no cleanings this time. Normally in a medical brigade, we don't see dental, but today, because we're so many of us, I'm from A&M, but we have a London group and we also have another group, and we were able to fit in the dental to help the community because they don't have that many dentists available to them. So we were able to see all these cool extractions by the dentist here.
Yeah, that's awesome.
I know.
Do you feel like, so have you shadowed a doctor in the US?
I have, yeah.
Okay, have you ever shadowed a dentist?
I haven't. I've mostly been focused on the doctor side, which is my
Okay, cool.
Mm-hmm.
Well, it's great that you got a little bit of everything. while
Yes,
you're here.
we were so excited. And
Yeah.
the coordinator was like, guys, we get a dental station. And it was so cool.
Yeah, you got the whole picture.
Yes,
That's
we
awesome.
do. Mhm. Well, this is Charla. Here we give information about public health, dental hygiene, hand washing, germs, chronic diseases, all about that for the adults. And then we kind of talk a little bit about dental health, flossing for the children. It's important they kind of get into the habit early on. And we also have a little Lego activity we give them that, shows them the toothbrush, shows them cavities, shows them, if you get a golden tooth, that type of thing, which really is interactive for them and helps them learn faster.
Yeah, that's awesome. I like the Charla station too, just because it's really interactive. Like, I feel like it's a fun chance to get to practice a little Spanish for people that maybe, are on a brigade and learning more about medicine, but also just to have a more personal chance to get to speak with people here, both kids and adults, and educational, but also more relaxed way. I think it's such a nice way to connect with the community members that are here while you're on a brigade.
I so agree. I've enjoyed practicing my Spanish, even though I speak, but also seeing my friends, practice their Spanish too.
Yeah.
It's nice.
Awesome.
Yeah. Right now we're gonna go ahead and enter the pharmacy, where we have an amazing pharmacist here from the country who has been able to help us hand out medications. So we separated all of the medications into a few categories, just chronic, antibiotics, pain medication, all that good stuff, to make sure we have more organization so we know where we're going whenever a prescription comes in from one of the physicians. It's easier to find them. The prescriptions will come in, and then someone from our brigade will find the medication, put it in, and the pharmacist will dispense it and kind of explain to the patient how to use it. Sometimes, most of the common medications that we're giving out right now are antiparasitics due to the water situation here in Panama. It's been kind of iffy. And then pain medication, as well as chronic pain, chronic disease management.
And you said you're a farm tech.
I
at
am
home,
a
right?
farm
Okay.
tech. I'm a licensed farm tech, so this is kind of my wheelhouse. I really like all the medications, and I've been doing it for about 2 years now.
Okay,
So I really
awesome.
love it. Yeah.
Okay, cool. That's really great that you could translate that to
Yes.
what you're doing here. Has this felt really different than like a typical day at the pharmacy in Texas?
It definitely does feel different. It's funny because I do speak Spanish, but some of the medication I'm like, what is this? And then I kind of realize what it would be at home, and I'm
Yeah.
like, oh, I got it.
Awesome.
But,
I love that even though you speak Spanish, you're still strengthening your medical
yes,
Spanish
it definitely
while you're
helps
here.
while I'm here. Yeah.
Yeah, so that's
Absolutely.
awesome.
So behind us in the pharmacy, we have data entry. Because patients don't come into the pharmacy, we're kind of just stationed here. Here we take the forms, the patient forms, the doctor signed, the pharmacist looks at, and we input all the information into online Global Brigades information that our coordinator goes ahead and presents all the informatics, all the statistics, all that good stuff. And we have really hardworking Global Brigades back here because it's type of way. So we've been doing good.
Yeah, that's great. Yeah, I know the data informatics session can take a little tedious because you're entering everything online, but for us at GB, kind of on the flip side of it, all of this data is collected from all of our communities in all of our countries. So this is how we also assess, how's the impact going, which communities need more brigades, which community has, a ton of waterborne illnesses and therefore needs a water project. So it's neat to see everything kind of come full circle with the fact that everything is so meticulously tracked at this.
Yeah, and yesterday we have a few computers here, but we started just doing it on phones at the end. Everyone was just typing away. So we got through it really quick, and it was honestly not a bad thing. It was honestly fun, yeah.
Love to hear it.
Yeah.
All right, hey everybody, we are at the next community. So sometimes when we have a bigger group, we'll actually visit various communities in just 1 week. So right now we're at San Juan de Dios, still with the same group of students from Texas and England, and it seems like it's gonna be a really busy day. We just got here about 15 minutes ago at 8:45, and the clinic is supposed to start now at 9, and I think there were already about 200 people that were waiting, so I'm glad that we're visiting this community as well, and I think it's gonna be a busy day.
So what we do is identify which communities are we going to, with which groups are going to be assigned to these communities, and yeah, having like all the supplies on time, like medications, staff, professionals, usually like health professionals, doctors, pharmacists, and coordinators. What we try to do is first medical brigade, maybe dental brigade later, or if it's a mixed program, we try to do both at the same time. But we try to do every 3 or 6 months. When we're not bringing any groups to a community, what we try to do is to have a community health worker in that case, because when we're not given basic attention or primary attention to community members, if they have access to someone with basic knowledge of medicine, they will have some kind of access.
Sí, bueno, la brigada en realidad para la comunidad, para los habitantes y para nosotros ha sido muy importante. En primer lugar, pues porque ustedes han brindado sus servicios muy amablemente, respetuosamente, organizadamente también, y creo pues que le ha dado solución a muchos miembros de la comunidad, abasteciéndolos de medicamentos, la atención como odontología, que aquí a veces se hace difícil porque ellos tienen que trasladarse de esta comunidad rural a otras comunidades para poder recibir estos servicios, y de verdad que ha sido muy bueno.
This is a community, actually. It's a tiny community, but what they do, they just tell to the other communities that we are coming, and the other people of the other communities come into this community and get help. Well, the privilege of being in the city is you have private hospitals and you have this kind of accessibilities in the hospital, but the problem is that you have to pay a lot to get attention, and they can afford that. So it's so helpful for them that we came here and we can do it that for free.
Usually in the city, there are all the specialists are there. Here, patients have to travel 2 to 3 hours to get to a specialist. It's really hard, and to get their meds.
Give them the meds that they had to do 1 week travel to make it, so it's very helpful for that.
Right now, this is a brigade that have 3 universities and 1 organization. I'm just so happy that they are 4 type of universities and groups, but they are just 1.
We were both quite big groups, so we were working in different clinics, and then when we came back to the compound, we would play volleyball together and just chat, especially about the differences between the US and the UK. That's such a common conversation that we have. And then this year it was really nice knowing we were going to get to see some of the people again, and then it made the ice breaking so much easier because everyone just started chatting so much quicker. And yeah, we've just been talking about the differences, and then teaching each other slang and stuff. But yeah, it's definitely been I feel like everyone's just fitted together really quickly.
They were so enthusiastic to learn about this, how we do these things here, how we live.
But the truth is that the mechanic with the volunteers, be with them, live with them for a couple of days is very cool, because we can know each other not only in the work area, but also in the compound. We can do whatever we want, talk about anything, and it's not just work, it's making friends too.
Also, it's something that you learn in the process is how to interview the patient. That's really important. And even though we have a little of a language barrier, although we have translators, you will see how to direct an interview and get to the diagnosis quickly.
Really, it's learning how to how to communicate with people, especially when if you don't know Spanish. It's a lot of body language, and then paying attention to other people's body language, when they're uncomfortable, when they have pain, or that's something that I feel like as a doctor you have to be, or a healthcare worker, you have to like pick up on, because they don't always, you know, verbalize it. But yeah, so a lot of like interpersonal skills and learning how to work also with the team of other like fellow students that you've never met before in some cases, just like being thrown into working on your feet. Yeah.
Siento que no hay barreras de lenguaje, que sí nos pudimos entender, que nos pudimos comunicar. Somos todos humanos y de alguna manera siempre nos comunicamos, y siempre cuando es para un bien común, en este caso el servicio que ustedes brindan, que es para la salud del pueblo.
I've been trying to learn Spanish, so I'm definitely better than I was last year. It's been nice to like have little chats with some of the patients and the kids. Like that's been really, really nice, and like I'm glad that I spent the time to try and learn more Spanish. And also the doctors have been really good at translating, and the other translators as well have been really helpful.
I always say that viewing and learning the perspective of other people is always gonna help me grow in a way or another. So coming here, it will be an excellent experience either way. It will be really humbling too, I think.
I would say it's okay to be nervous, yeah. Jumping out of your comfort zone is, in my personal experience, is hard. It's not easy, but I've never like grown more, or both like with my skills and also like intellectually, than when I'm out of my comfort zone. And I think that one thing is, if you're debating it, just do it. That's going to be the most beneficial to the community and to yourself.
This is something that it's really impactful, and you see it in a community when you're doing a brigade. If you're having like doubts about what is this, or if this really has an impact in community members, it definitely has a lot of impact. And you see their faces when they receive a medication in a brigade, and it's like, oh wow, they really need it. Because you understand that they don't have access to something close to their houses to have health attention, and also it's really expensive for them to buy medications. So when a group is coming to a community in Panama and they are providing access to health, they're changing a lot of families' lives in Panama.
So for that students that are afraid of just coming to Panama and help people, just don't be afraid. You are going to have an amazing experience that's going to change your life, because if you want to be a doctor or a dentist or some professional of the healthcare, I'm saying that because this changed my life too.
I think that some people coming here to try to find an answer is if the decision to study med is the right decision, and I think that the brigade could help with us and the students to make that decision, because some persons are studying it because of their parents or by pressure, and some of them wants to like live the experience, and this kind of brigade could help them to make the decision and decide, okay, I want to be a doctor.
These medical brigades are also working parallel to our community health worker program that we also saw a little bit about when we had our conversation with Jeanette recently. So our community health worker program, like we've shared, is another way that we promote the sustainability of all of this. So in addition to these mobile clinics that are coming in week by week, we're also training local people to have medical skills as community health workers. So they're able to prescribe basic medications, provide first aid, and other general triaging that can support the community if there isn't a clinic very close. Overall, we have over 550 community health workers in Panama and Honduras. And one last thing that's really neat about the community health worker program is that it's actually recently rebranded to a community health entrepreneur program. And the reason for that is that the community health workers are not only providing the medication in the community, but they're also receiving training to learn how to sell it. So this makes it economically sustainable and also has a really crucial women's empowerment component, considering just about all of our community health workers are women.
The community health program started long ago. These partner communities that are working with Global Brigades, I would try to identify some leaders inside the community to train them and make kind of like a health leader inside the community. So usually what they do is they receive a training during like 6 months, usually from 6 months to 8 months, and different topics like pediatrics, chronic illnesses, hygiene, oral hygiene, all of that. And after they finish, they become a community health worker for their community.
Mi nombre es Janet Contreras, vivo aquí en la comunidad de La Peñita y también trabajo con Global Brigade, soy ACE, agente comunitario de salud. Aquí como ACE ya la comunidad sabe del que yo vendo medicamentos, ya me dicen de que enfermera y cosas así pues. Entonces me gusta mucho de ACE. Porque uno aprende bastante también de cómo tengo que yo recomendar un medicamento y yo le explico.
So when they graduate, if they have the space in their houses to be like, a small store or a small space to create the pharmacy, then we help them with our team doing, all the paperwork to open a community pharmacy.
Mi papel como agente comunitario me dedico a toma de presión, glucosa y temperatura. Junto con Ali, Elisa y Diego tenían esa opción que podíamos tener un botiquín en la comunidad. Y para buscar un medicamento más cercano aquí a Panama, es como 45 minutos al llegar allá.
Selling the medications it's been growing a lot because it's the only access to medication in that area. Usually it's nothing close to get attention or medication. This is a big improvement for the community.
Me gustaría sí que creciera un poco más mi botiquín, porque yo sé que eso me va a cambiar la vida a mí. Sí.
En el futuro, sí. Tener más medicamentos a la venta y estudiar más para tener más conocimiento para poder yo atender a las personas más bien.
So have you heard about our new research program so far a little bit? Yeah. So our new research program is an opportunity where students can come to Panama or come to Honduras and conduct research about our community health worker program. So this is really cool. It's a unique opportunity. It's different than the typical medical brigade because you're not going to be spending all of your time in clinic, but you're going to have a chance to really go a little bit deeper and see a side of our year-round programming. This is something that previously was, a little bit more internal and not as much with students, but I think it's a great opportunity to see the whole picture. So students through our research program have the opportunity to come and spend some time in a community doing both qualitative and quantitative research. So qualitatively, they're conducting interviews with the community health workers about the impact in the community, but also the impact on their own lives. Because I'm sure you've seen a lot of these women have been really impacted by having this program.
Yeah, and I think it's really important to mention that although we have community health workers there, doing the job, we usually don't do, for example, these interviews or questions about if the program is really working or how far it's going, if it needs some changes. To provide better access, or if we need to change a little bit of topics that they're receiving with the training. So it's really important to understand and identify the challenges in the communities with community health workers so we can, try to improve something. So I think as students doing this will be great.
Yeah, perfect. And like I said, it's qualitative and quantitative. So in addition to the interviews with the community health workers, they're also conducting surveying throughout an entire community. So I joined one group where we did this already, and it was so neat just to be able to walk from house to house and get to talk with different people. I mean, you're accomplishing so much in one. You're learning about research, you're seeing the impact of this program. And most importantly, it's also helping us as an organization improve this program. I mean, as a nonprofit that is relatively young, we are always changing and always seeking to improve. So this is also a great way for us to get feedback from community members and continue to improve this program. I mean, as you were talking about earlier, this program has already changed so so much, and that originally it was just a CHW program. They were just providing the healthcare. But since it's now a CHE program with the entrepreneurial element, it's so much more sustainable. It's empowering women economically. When we spoke with Janet in Las Piñitas, she was telling us how, she hasn't had a lot of educational opportunities, but for her to have a chance to make money through her pharmacy, like, she was so excited to talk about that, and was talking about how her husband is also so thrilled of like this new dynamic in the family. So like that part of it too, the economic element, I think is so crucial to like making all of this work in the long term.
Yeah, it's like, those small focal points in the economic side and the health side that you're kind of providing health, through medication like OTC, because you usually over-the-counter medication, but it's basic and it's something that every community needs. So first they're having access to that. And also there's someone growing up with a business there. So it's somehow helping or trying to support the community to grow. It's not going to happen in 6 months, and it's not going to happen in a year that the community is going to grow exponentially. But 5 years, 4 years, or maybe more, there will be a business there that it's going to, increase the development of the community.
Yeah, awesome. Well, thanks for taking some time to chat with me a little bit more about this. I think it's really interesting, and I'm hopeful that students too, if you are thinking about coming on a brigade, if you're interested in learning more about medicine and also public health and global health and even the economic side, I think regardless of your background, there's so much to learn through one of these experiences. So I'm hopeful too that we're going to continue to grow this program, grow the research, and continue to grow the impact and improve on the ground.
Yeah, thank you.
Thanks. All right. Hey, everybody. So while we are here, we, of course, need to see a little bit more about the canal. You can't visit Panama or visit Panama City with also learning a little bit more about the canal and how much it's impacted the culture. But something that's really cool is that where we are now is where the river Changres attaches so to this side is the natural side. So this is the river that was naturally formed here. And then to the other side, you can see where things become more man-made and connect to the rest of the canal. So first, we're going to start exploring a little bit more on the natural side. So even though there is, a lot of construction, a lot of things that are man-made, connecting to the canal and connecting to the locks of the canal in this direction has a lot of things that are pure nature and still protected as how they originally were. So we're gonna head out in a boat, and we're actually gonna go visit Monkey Island, which actually is a bunch of islands where we'll be able to see a couple different monkeys and just explore a little bit more of the nature in this area. We have had such a packed trip so far, visiting our water project, getting to see the mobile clinic, and also getting to spend some time talking with our community health workers. A theme throughout all of these visits has been water. We saw the challenges that many communities in Panama face with potable water access and waterborne illnesses. We've really learned so much, and part of the brigade experience overall is getting to jump right into the local culture. So of course, while we're here, we have to make a quick stop to the Panama Canal. Let's go.
Uno de los datos más importantes que tenemos que llevar a mención en este momento se trata de el logro que hizo el señor Gorgas, William Gorgas, el médico por parte de los americanos, el cual logró identificar que la malaria y la fiebre amarilla eran producidas por el mosquito Aedes aegypti.
Como sabrá Panamá, el éxito para la construcción de su canal fue el control de esos vectores, agentes que enfermaban a la población que estaba alrededor del desarrollo de esa actividad, como el canal de Panamá. Si nosotros trabajamos en un área selvática, tenemos que tener una barrera de protección, y esa barrera de protección la garantiza como la fumigación. Esto es clave, es éxito para evitar que nuestras personas se estén enfermando dentro de las áreas donde están desarrollando esas actividades.
En el área del Canal de Panamá no solamente pues, se utiliza para el paso de barco, también nos ayuda, le da agua a la ciudad de Panamá y viven entre sus alrededores comunidades nativas a lo largo y ancho del río Chagres, igualmente en el área del Gatún. Y utilizan este río o estos ríos para su movilización a través de las vías que conectan lo que hoy conocemos también pues, como el Canal de Panamá.
All right, hey everybody, so we're just about finishing up our trip. It has been an awesome experience. We really have gotten to see a little bit of everything this week. We've had a lot of fun. We, were laughing the entire time on the boat, getting to see monkeys, getting to spend time with students and staff members that I've met before. But of course, there are things about this trip that have been challenging too. It's of course really hard to see homes that don't have water access, or to be in a clinic where there are hundreds of people waiting in line for hours because there isn't, an affordable and accessible alternative available. So it's not all easy and fun, coming on a trip like this, but I think more than anything, I'm still left with a sense of hope, and I think that this work is really meaningful. So I hope that for everybody that's watching, this has been a helpful glimpse into what it looks like to work with Global Brigades. It's a little bit of everything. You're gonna see things that are challenging, you'll be outside of your comfort zone, but you also have a chance to make an impact, and there's also a lot of fun that goes along with it. So I hope that this inspires some of you to get involved as a volunteer, or even to start your own chapter as a leader. I know it takes time either way. I know that there's effort involved with being able to travel internationally in this way, but I think just what I want to convey is that it's so worth it. I mean, the work that Global Medical Brigades is doing matters. It has an impact on these communities, and we would love for you to be a part of it. So I'm going to go ahead and jump back on, and we'll connect a little bit more on some next steps and how you can get involved from here.